Welcome back once again. Now, a South African initiative called Goodbye Malaria partnered with the University of Pretoria and the Mozambican Government Department of Health in opening the Center of Excellence in Mozambique. Now, the aim of this partnership is to eliminate malaria in Mozambique by 2030. At the forefront of malaria research and control and spread this knowledge to the rest of Africa. Joining us in studio this morning is the Sherwin Charles. He's the CEO and co-founder of SA-based Goodbye Malaria. Good morning to you and welcome to Morning Live.
Good morning, Belisa.
Thank you very much indeed for your time. Now, malaria is one of the world's biggest killers, particularly in the sub-Saharan regions of Africa, especially among children under the age of 5. Tell us about this initiative, Goodbye South Africa.
Goodbye Malaria was started by Robbie Brosen, myself and Kim Lazarus. We had seen the scourge of the disease on the continent by traveling over the years with Kingsley Holgate. And during our travels with Kingsley, we would hand out bed nets. What we realized is that we needed to make a big impact with regard to malaria, because malaria in today's age, why should anybody being bitten by a mosquito die from malaria, especially children under 5? And at the time, malaria was the biggest killer on the continent of our children. So we decided that we needed to have an impact on the continent. And obviously with the skills one has learned from Nando's and their franchising model, we felt that we could get a program for elimination in Mozambique that will allow us to almost put business in a box and transport that knowledge to the rest of the continent to assist in the elimination of malaria.
And South Africa on its own is also affected because we're sharing borders with countries that have high malaria transmission and poor controls.
For sure. I mean, South Africa is affected in northern KZN, the border with Mozambique, obviously along the our eastern side with the Kruger Park, Limpopo, and Mpumalanga. Those are malaria endemic areas in South Africa. We have seen a rise in the number of cases, a lot of it imported from Mozambique. Thus, we started our program in Mozambique because we felt that having an impact in Mozambique will have spin-off effects for both Swaziland and South Africa.
Now, can you explain to us what is the specific purpose of Center of Excellence?
The Center of Excellence, we established it to really show what a true private-public partnership would be about. We're very excited to announce the collaboration with the University of Pretoria. I mean, that for us is big news. And really the Center of Excellence would look at taking the best of research, the best of implementation, the best of technology, and showcasing it and implementing it in the world of malaria. Malaria can be beaten. It's totally preventable. It's totally treatable. We should not be seeing people die from malaria in this day and age.
And one thing that our viewers do not know this morning is that you are on your pajamas. You are on your social pajamas, right?
Exactly.
Tell us more about the initiative. I know that you do have the Pajamas Initiative as well as the Bracelet Initiative.
Absolutely. I mean, the bracelets have been a wonderful tool for us. We launched it in 2010 to showcase the first World Cup in South Africa. Since then, we've managed to raise $750,000
just for the bracelet.
From the sale of the bracelets.
And I can imagine that you might be able to raise more with the pajamas.
I'm hoping so. So certainly we've done Shwe pajamas. I'd love everybody, today's World Malaria Day, to go on to www.goodbyemalaria.com and buy a pair of these Shwe pajamas. Why
specifically use the Shwe material? Why specifically?
I think we felt that it had to be originally African. It had to be an African design, African material and cotton. So we chose the Shwe material. It's got wonderful colors. It's got a great history to it. And that's the first set of pajamas we made from Shwe.
I can imagine. But I don't. How comfortable are they? I'm actually feeling the material. It's quite soft. How comfortable are they?
Extremely comfortable. I mean, it's not starched Shwe material. They get incredibly soft as you wear them. I mean, I've got them on right now.
And no one can notice that you're actually wearing pajamas this morning.
Absolutely. And we've then used the offcuts from the pajamas to decorate other items of clothing. So this shirt has got the Shwe decal on it.
Beautiful one. Beautiful. I love my Shwe, I must say. As Mosotho, I love my Shwe. So it's quite an initiative to have to be able to sleep in my culture, isn't
Absolutely. And
It
we
is.
said that, the profits of the sale of these goods go towards the projects in Mozambique, and it's as simple as saving a life in your sleep.
That's it. Okay, now what role will the University of, I know that you did explain a bit, but what role will they play? I do know that University of Pretoria, for instance, they've been having this continuous researches on malaria.
Yes, they're one of the newest kids on the block, to say. They have an incredible department there. I think it'll do two things for us. One, allow for research to happen in Mozambique, so students who are studying their masters or their PhD can come and work in an endemic country on the entomology. So it'll be wonderful to do that, as well as they will be the research arm and evidence arm for government in Mozambique. They will collaborate with a local university in Maputo.
Great stuff. Thank you very much. That's Sherwin Charles. He's the CEO and the co-founder of SA-based Goodbye Malaria. So now you can be able to sleep in your seshasha. Great stuff indeed. We're taking a break. When we come back, Money Life continues. Stay tuned.